Arthritis, a condition characterized by inflammation of the joints, affects millions of people worldwide. While various factors contribute to its onset and progression, diet plays a crucial role in managing symptoms and inflammation. Have you ever noticed severe pain after consuming a particular meal? What you eat could be secretly worsening your arthritis. In this video, we'll reveal the real story behind the foods that may be causing your arthritic symptoms to flare up. You might be surprised to find some familiar foods on this list of certain foods can exacerbate arthritis, leading to increased pain and decreased mobility without you knowing. If you want to know how to reduce the risk of arthritis, watch this video to the end for essential advice, backed by scientific evidence. So, without further ado, let's begin. At number 1, red meat. Red meat, such as beef, lamb, and pork, is high in saturated fats and omega-6 fatty acids, which can promote inflammation. Studies have shown that arthritis might worsen as a result of red meat consumption, especially when done in excess. Arachidonic acid is the primary culprit. It's an omega-6 fatty acid that's abundant in red meat. Consumed arachidonic acid is transformed into prostaglandins, which are chemicals that cause inflammation. The body's inflammatory response is significantly influenced by these prostaglandins. Excessive production, although necessary for several body processes, might worsen joint inflammation, which is a common sign of arthritis. Studies has also found that high consumption of red meat is associated with increased levels of C-reactive protein, an inflammatory marker linked to arthritis. Number 2, sugary foods and beverages. Sugary drinks have emerged as a significant contributor to the global obesity epidemic, a condition closely linked to osteoarthritis. The excessive consumption of these beverages can lead to weight gain, putting additional stress on weight-bearing joints like knees and hips. Beyond obesity, sugar itself has a pro-inflammatory effect on the body. When consumed in excess, it can trigger a cascade of inflammatory responses. Chronic inflammation is a key player in the development and progression of various arthritis types, including rheumatoid arthritis. Studies have demonstrated a correlation between high sugar intake and increased levels of inflammatory markers in the blood. These markers, such as interleukin-6, are closely associated with arthritis severity. Let's move on to number 3, fried foods. Fried foods are a primary culprit in exacerbating arthritis symptoms due to several factors. They are high in unhealthy fats because they are typically cooked in oils that are high in unhealthy fats, such as trans fats and saturated fats. These fats contribute significantly to inflammation, a key factor in arthritis. A study in the Journal of Clinical Endocrinology and Metabolism found that trans fats are associated with systemic inflammation, while research in the Journal of Nutrition links AGS to increased inflammation and oxidative stress. The high-temperature cooking process involved in frying creates harmful compounds called AGS. These compounds are linked to increased inflammation and oxidative stress, both of which can worsen arthritis symptoms. Many fried foods are high in sodium, which can lead to fluid retention and increased joint swelling. Reducing your consumption of fried foods and opting for healthier cooking methods, such as baking. Number 4, refined carbohydrates. Refined carbs are rapidly digested, leading to spikes in blood sugar levels. These fluctuations can trigger inflammatory responses in the body, which can worsen arthritis symptoms. Foods such as white bread, pasta, and pastries have a high glycemic index, causing rapid spikes in blood sugar levels and promoting inflammation. A study in the American Journal of Clinical Nutrition demonstrated that high glycemic index foods can increase inflammatory markers, potentially aggravating arthritis symptoms. Number 5, salty foods. Salt causes the body to retain water, leading to swelling, particularly in the joints. This can increase joint pain, stiffness, and inflammation. Some studies suggest a link between high sodium intake and high salt intake can contribute to inflammation and increase the risk of developing high blood pressure, which can negatively impact overall joint health. Research in the Journal of Clinical Investigation has shown that high sodium intake can exacerbate autoimmune responses, potentially worsening conditions like rheumatoid arthritis. Number 6. Alcohol. Excessive alcohol consumption can lead to increased inflammation and weaken the body's ability to repair itself. It can also interact negatively with arthritis medications, reducing their efficacy. A study published in Arthritis Research and Therapy found that alcohol can increase inflammatory markers and exacerbate arthritis symptoms, particularly in heavy drinkers. Excessive alcohol consumption can elevate uric acid levels in the blood, a primary cause of gout, a type of inflammatory arthritis. Thanks for watching. The information provided in this video is intended for general knowledge and informational purposes only and does not constitute medical advice. It should not be considered a substitute for professional medical diagnosis or treatment. Always seek the advice of your healthcare provider for any questions about your health or medical conditions.